Shababul Muslimi Ikwanul Mu'minin.
Hello everyone, I'm by name Dr. Mustapha from Ahmadu Bello University Teaching Hospital, Zaria. I'm here today to talk about implications of fasting in general among adults and children. Fasting can be defined as an abstinence from drinking or intake of food for a particular period of time. Going straight to the point, implications of fasting can be positive or negative implication. The positive effects of fasting includes it promotes blood sugar level. Most especially, this is very important in a diabetic patient. However, it's not general to all the diabetic patient. It's subjective to diabetic patient. And second positive effect is it promotes health. How does it promote health? It promotes health by limiting the rate of chronic inflammations. And chronic inflammations leads to different non-communicable diseases such as arthritis, multiple sclerosis. Study has also shown that. And another positive effects of fasting is it promote healthy heart. How does fasting do that? One, it does that by reducing blood pressure and also controlling the blood level of cholesterol and triglycerides. Also, fasting also helps in what? Weight loss. It helps in weight loss, which is very, very important, as we all know that today in our world, people are involved in eating junks just to get fat, and getting fat leads to weight gain, obesity, and obesity is involved in a vast majority of non-communicable diseases as a risk factor, such as in diabetes, in hypertension, in also atherosclerosis, coronary heart diseases. And also fasting also is important in boosting brain function and prevention of neurodegenerative diseases. What are these neurodegenerative diseases? This includes Parkinson's disease, Alzheimer's, and the rest of them. Fasting helps in preventing such kind of diseases, most especially among adults. And also fasting also improves aging and also longevity of life. This study was done among animals, and it shows a positive effects, and it's a study done in UK. You can check it up in National Health and Services in the UK, or you Google it up. Also, should I say this one of the reasons why some of the doctors in the hospital, you see them looking young while they are old. It's just because one way or the other we are involved in what? Intermittent fasting, being on patient for like 7 hours. Now, going to the negative effects. Negative effects include dehydration. Of course, you'll be dehydrated, most especially in dry fasting. However, in wet fasting is the opposite. There's no consumption of solid food, but someone is actually consuming water. And also, another negative effect again is hunger pangs, weakness. Somebody will be hungry and you're having weakness, and usually people associate ulcer with fasting. So it's not so. And I would like to tell you to know that the fasting also reduces the level of acid secretion in the stomach, which prevents ulceration, to prevent gastric ulcer. However, during fasting, what leads to heartburn or ulcer is when someone perceives the aroma of food or thinks about food. Immediately there will be a secretion of acid in the stomach, and which leads to heartburn. That's why people associate ulcer to heartburn. So the things to look out for in children that are fasting is to look out for dehydration, look out for heartburn, headache, and what? Body weakness. There can also be, children can also be involved in wet fasting, not to eat solid food, but intermittently taking of what? Water before their body acclimatizes to within 24 hours or 24 to 72 hours of fasting. And also another thing that I would like to briefly talk about is how to prevent ulcer. To prevent ulcer, mostly in children or in adult, ulcer, as we know, is not hunger. About 80 to 90% of patients, develop ulcer via consumption of contaminated food with H. pylori organism. H. pylori organism is a culprit. It's a culprit in ulcer and causes ulcer in both children and adult. So personal hygiene matters here very well. Personal hygiene, cooking with good food, cooking good food, and should I say avoid food vendors along the road. You don't know where the food is coming from. Is the person clean? So because the H. pylori is transmitted fecal-orally. So thank you for listening. And if you want to get more information, you can Google healthline.com or National Health Service in UK. Thank you very much.